Hello everybody, it's Dr. Yu here. Welcome back to the channel. As you probably will know, I've been absent from recording any videos over the last year. And the reason for that is very simple. I started a clinic. Yes, I started a clinic. It is not a family medicine clinic. It is actually a child psychiatry clinic. A child psychiatry clinic. And that is because across Alberta, the province where I am in Canada, there is such a pressing need for child psychiatry services. I am a family physician, but I obtained a child psychiatry fellowship. Not saying that I'm a child psychiatrist, but this is an area of passion and special interest of mine. And so I gathered together a team of wonderful, dedicated doctors and staff, and we've gone ahead and we've started a clinic. So with that, let me share with you some information about what this clinic is, how we help people, how many patients we've seen now, because recently we've just had our 1-year anniversary, and if you're a patient seeking child psychiatry or mental health services, how you can get a hold of us. So this is a slideshow that we've prepared for our 1-year anniversary. So why do we have a child psychiatry clinic? Well, the goal is to solve problems, and the problem is poor access for patients and families to child psychiatry services. Routinely across Alberta and most of Canada, people are having to wait over a year or two to access psychiatry level services or mental health services provided by a doctor where we can prescribe and diagnose mental health conditions. Now, that's fueling a growing mental health crisis across the province. There's a shortage of child psychiatrists across the province, and also a related problem is that family physicians are burning out doing the generalist work that we do on a day-to-day basis. The problem is, of course, exacerbated in rural Alberta and the Northwest Territories. I think across all of the Northwest Territories in the far north of Canada, we only have about 2 child psychiatrists. So we've gathered together an excellent team of family physicians with specialized training in child psychiatry, as well as child psychiatrists themselves. Our impact over the last year has been significant. We've managed to lower wait times from over 2 years in some cases down to just about 2 to 9 weeks, and we can fit in patients who are seen in the emergency room for suicidal thinking very quickly within about a week or two. In total, over the last year, we've helped about 567 patients. Out of this total, 179 have no family physician. So these are patients that would not otherwise have had access to the healthcare system, let alone child psychiatry, because typically it would require a family physician to refer a patient to access specialized services like child psychiatry here in Canada. Now, our clinic is special because we accept self-referrals, especially for patients with no family physician. This is especially useful. The number of self-referred patients that we've had in the last year is 391. We've served over 65 communities across Alberta and the Northwest Territories. You can see that most of our patients live in Edmonton or Calgary. However, we also serve patients in the Northwest Territories, such as Yellowknife and Fort Smith. Fort Smith is a town that I've worked in many years now, and also it is the birthplace of current Canadian Prime Minister Mark Carney. You can actually click the link above to check out a video of me working in Fort Smith. In terms of gender and age gap, we're able to use data to track patients' gender and also their age, and we can actually track how many appointments a typical patient will get. So our clinic average is 5 visits per patient, and the median value is about 4 visits per patient. Next, I'm just going to read out some very touching messages that we've been getting from our patients and our allied healthcare professionals over this last year. So this one comes from a psychologist in the community, and she says she wanted to reach out as an assessment psychologist who specializes in the under 18 population and a parent of a trans teen with a complex mental health issue, to say thank you, and a million more thank yous for starting this service. You are so desperately needed. Another allied healthcare professional reached out with a message thanking us for the incredible work we do. She says that she has been working with a family in Lethbridge for well over a year. They had lost all hope for their son. Things were not looking good. They exhausted all the avenues. She sent them our way, and for the first time, she has seen hope and relief in their faces in over a year. We took them seriously. We addressed their issues with passion and care. She cannot thank you enough for this gift. So that's a very kind message. Thank you. People have also been commenting about us on Facebook. And this is a mother who shared her thoughts about our services. And finally, we also have a Facebook page where we can actually connect with patients, and people leave reviews for us as well. So thank you very much for the kind feedback. We always try to do the best for our patients. Now, we even got a positive shout out from the president of the College of Family Physicians of Canada, Dr. Carrie Bernard. Thank you, Dr. Bernard. So she says that in addition to championing the team-based care model, the CIPC supports family physicians training to address specific care gaps in the community. Dr. Yu is using this model to address lengthy wait times for children's mental health services in Alberta. His virtual care clinic is a collaborative effort between family doctors who received advanced mental health training and child psychiatrists who act as consultants. The family physicians in the clinic continue to work in comprehensive care and gain fulfillment by adding specialization to their routines and in knowing that they are reducing the burden for their colleagues struggling to help children waiting for psychiatric care. The clinic has helped over 400 patients in Alberta and Northwest Territories since May 2024. Such creativity is yet another way family physicians are part of the care access solution. Again, thank you, Dr. Bernard, for the shout out. So you can see our clinic goal is not only to serve patients, but also to help doctors and give doctors a meaningful way to contribute to the health of their community. Making sure too that doctors are well paid for the work that they do because our clinic charges very minimal overhead, and also minimizing the administrative work that doctors do so that they don't get burned out. If you want a glimpse into how much administrative work family doctors have to do otherwise, you can check out this video of me reacting to Dr. Glaucom Flecken and his family medicine caricatures. Now, for those of you looking to get access to our child psychiatry services, you can just head on over to joycehealth.ca, and then you can click Contact Us, and then you can use the self-referral form to fill out your basic information and send us a message so that we will be able to then contact you to book you in for an appointment. Now, please be aware that this form is non-secure, and so please don't put your confidential medical information there. You can also call us at our phone number or leave a message, and our secretary will get back to you. Feel free to browse our website as well to learn more about us, to read about how we work, to read about who all is on our team and their brief bios and their background, and also to access a list of resources for parenting advice, referral forms, questionnaires, resources for anxiety, ADHD, as well as all the other resources. And if you are a doctor out there looking for extra work, and if you have child psychiatry experience and want to make a difference, we'd love to work with you. You can send us an email to reach out to me directly. And that's it. That is why I've been absent for the last year on YouTube, but I will endeavor to make some more videos coming up. I do have plans to react to a number of very popular YouTube influencers like Dr. Pimple Popper. I do have some of my own videos popping zits and other such items on my own patients, as well as reacting to Uncle Roger and doing a follow-up to my postpartum confinement video that I did a couple years ago. Stay tuned for that. Have a great day and see you in another video.